Welcome to Healthcare ID Today. I'm John Lynn, together with my colleague and friend Colin Hung. The world of technology and healthcare, ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health ID news, meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. On today's episode, we'll be discussing our 2020 health IT predictions. We're going to see if we can predict the future. I got my magic ball ready. And be sure to follow the show on Twitter at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 13 years of health IT blog content at healthcareidtoday.com. You good at predicting the future, Colin?
No, otherwise I would be living in Vegas if I could predict the future. So no,
that's different predictions, right? The gambling that's a different prediction. Yours is an educated prediction in health IT.
Sure. We can make as many educated predictions as we want because only our friends are going to help us keep score. Because I'm sure they're going to remind us when they see us in 2020, like, hey, Colin, you got it completely wrong about the fact that Google was going to take over the world. Oh wait, they've already done that. Sorry.
Next year we're going to do an episode called where Colin was right and where Colin was wrong, and where John was right when John was wrong, and we'll review our predictions, and hopefully there's some right too.
There you go. Hopefully we'll get 1 out of 5 right. No, it's gonna be fun. I mean, it's the end of the year. It's the end of the decade, so it's kind of fun to look forward and kind of base on all the shows that you and I go to, all the people we talk to, and just kind of see where you and I think things are going to go next year.
Well, in baseball, if you get 2 out of 5, that's a Hall of Fame career, so that's good.
There you go. There you go. So why don't we start, John? Let me ask you, what will be the biggest success that we're going to be talking about in 2020?
So I actually, I'm kind of going to spoil the second topic as well, but I think we're going to see the biggest success from Amazon. Amazon is going to be the biggest success in healthcare. I think they're going to do something to really change the game. So I think they're going to be really successful. I actually think Google's going to be quite successful, and I think Microsoft and Apple are probably going to be on the other end, although I don't want to spoil the failure.
Okay, all right. I mean, well, you picked one of mine. I definitely would say Google is going to be one of the biggest successes in 2020. I mean, they've had their little, a little bit of tarnish on them right now because of the latest stories with Ascension and all that kind of stuff. But I think overall, we're going to see some pretty impressive things from Google, not only in terms of their cloud, but also, of course, with their analytics and all the other work that they're doing, the strategic hires they've made. I think that they're going to be successful in 2020, and that's certainly my big company pick of stories that we're going to be talking about next year. On the smaller scale,
I would argue that, Colin, I would argue that the fact that they failed on that, kind of they had a little tarnish from the Ascension privacy issue is actually going to make them stronger and is why they're going to be successful.
I hope so, and that's why I'm putting my prediction there. I think they're a company that has shown to be able to learn from mistakes. I mean, we all know about the failure of Google Plus, right? And they learned from that, and they're doing other things now. And they learned from. I think they've learned from their their foray into personal health records, and they're applying that now to the things they're doing. So I think with the acquisition of Fitbit and with some of the other things they're doing, I think they're poised for some pretty big success in 2020.
Yeah, and even more so is Karen DeSalvo and the other healthcare leaders they've brought on board. That's really good, and that's actually why I like Amazon as well. They have some really good health chops there in their leadership, but also their reach. So who is the small company you're looking at?
Yeah, so I think on the smaller scale, I don't have one in particular, but I was going to say a successful area I think in 2020 is going to be something that you and I have spoken about before, but revenue cycle. I think is actually going to be an area where we're going to see some pretty good success in 2020. And when I say success, I don't mean that the software is going to be going like gangbusters. I mean actually that the workflow, the focus on return, the focus on patient experience, I think that's finally going to be an area where people go, you know what, we have made this a lot easier now. I'm looking at that area, and I'm just seeing some of the new systems that are coming out, some of the new partnerships with banks, partnerships with people where they can put patients in contact with foundations to get financial assistance. I see all of that sort of happening in the RCM space, and I think that'll be one of the success areas that we're going to be talking about in 2020 on the smaller scale.
Nice. And I'll throw out a smaller company, other than not that small, is Zelf. I just think they have the right partners with the large health systems, and I think that's just going to explode in 2020 for them. I think they're a little bit ahead of the curve. They probably were early to market, but I think 2020 is going to be a breakout year for many of them. I just think they've put together the right partnerships to really grow what they're doing and make it successful. And they're really an interesting platform for a wide variety of startup companies. Another example of that is Baby Scripts, who I think is doing some really interesting stuff in the maternal care space. And so Zelf will be able to ride the success of companies like Baby Scripts, that they're able to connect across a wide variety of health systems. So there's a little smaller company that I think will have a great success in 2020.
Nice, good choice. I just was listening to their CEO speak at a recent conference in Pittsburgh. I definitely agree with you that Zelf is definitely a company that will be fun to watch in 2020, not to spoil our topic number 3. But so we've talked about successes, John. We've got to talk about the opposite. I mean, it wouldn't be a show if we didn't talk, if we were too positive. So let's talk about the disasters. Who or what is going to be the biggest disasters we're going to be talking about in 2020?
So I will make a kind of a dual prediction. I think a really large company is going to go down, and I think it's probably going to be an EHR vendor who's going to have some sort of big privacy breach, or a big something that just literally takes down their business. And I think that it probably won't disappear completely. It will get acquired by Allscripts, or someone that loves to take in the bygone EHR vendors. But so I predict one of them is just going to have some massive breach, or breach of ethics, or something along those lines, that's just going to take them down, and just they're going to basically disappear, probably get acquired, or acqui-hire essentially for their customers. And then on the provider side, I think we're going to see something where probably a breach as well, but it could also be a internal breach. I'm not sure if it's necessarily a Me Too, or something along those lines, where a whole organization, IT organization, comes down. Could be Medicare fraud or something along those lines, instead of something along the Me Too. And we're going to see that at a large organization. The interesting thing is, I don't think it's going to take down the healthcare organization, but it's going to make a lot of news. It's going to tarnish their brand and reputation. It's going to be a real challenging thing for this organization to come back from. But the interesting thing is, it won't disappear. Probably just get rebranded, and the hospitals and health systems need to stay there. So unfortunately, or fortunately, depending on how you look at it, they're going to survive. But so that's I think going to be my big disaster, is this health system just being like, wow, I can't believe that was happening.
Cool. I'm going to go with 2 as well, but different than yours, which is good. From a non-health IT, but a healthcare perspective, I think the biggest disaster we're going to be talking about in 2020 is actually the equal pay and the gender gap in and how, frankly, women are treated in the medical system. I think that, much like how healthcare kind of lags behind the rest of the industries, I think it's going to finally hit the medical industry, in the sense of, are we really paying people the same? Are we really treating them the same? I think that the old boys club stories, I think, unfortunately, are going to come out, and they're going to be a little bit of egg on the face of a lot of people. I think it's time that these stories start to come out, and I think healthcare will be stronger for it. But I think it's going to go through some of that sort of soul searching, and some of the looking inwards that other industries have had to do. But healthcare doesn't seem to have happened quite yet. So I think that, from a non-IT perspective, will be the story we'll be talking about in 2020. On the IT side,
it's interesting you say that, though. Real quick, it's interesting because healthcare is unique because it has its girls club known as the nurses, right? And so maybe that's why they've avoided it. I don't know for sure, right? Like, we've started to see it come out with the doctors and even IT professionals and people, but I think they've been able to avoid it by saying, oh yeah, we're 50-50 female male because there's so many nurses that are female. So I wonder how that dynamic will play into it. But yeah, that's an interesting prediction.
Well, and I think I think that's sort of what has kept things in balance, because there are so many female nurses, right? And so when you look at the industry as a whole, you go, well, there's the numbers are about the same. However, when you look at the female surgeons, you look at female administrators, CEOs, CIOs, even the numbers are very small, and disproportionately small compared to where they should be. So I think that's where we're going to start to see some of that. Hey, like the way that the way that the promotions happen, the way the pay scales happen. I think that's going to come to light in 2020. At
And
least
we
I
have
hope
the
it does.
data.
And we have the data now. Sorry, from an IT perspective, I think one of the biggest disasters in 2020 we'll be talking about is actually something around reputation, kind of borrowing what you're saying, John, but I don't think it's going to be a breach. I actually think it's going to be unhealthy or monopoly type of behavior from certain companies. And why I say that is because one of the stories I'm looking forward to in 2020 or very soon is the new rule around information blocking. And some of the practices that companies have used to essentially, bilk or milk their clients in order to access their own data, I think those are going to come to light. And I think, as you pointed out, I think some companies are going to have a lot of explaining to do, and some won't survive because of it. But the stories of, forcing partners to give up 20% of their ongoing revenues just to be able to access APIs, I think those are going to come out, and I think people are going to scratch their heads going, why would we want to do business with a company like that, right? And before, this was all hidden. In fact, it was probably written in the contracts, so you probably couldn't talk about it. But I think those stories are going to come to light because now there's going to be legislation that says, hey, you can't actually do that. And I think we're going to be in for a flood of stories around, these sort of uncouth or uncapitalistic business practices.
Yeah, so we had too big to fail in the economic industry. I wonder if too big is a problem in healthcare in a different way, as far as not too big to fail, but too big to operate efficiently, to operate effectively. I think there are some real interesting monopoly concerns in healthcare because of all the acquisitions, and I could see that really hitting the fan.
Yeah, I think that's going to be some of the disasters that we're going to be talking about in 2020. But hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Please take a minute to check out our story archives at healthcareittoday.com. Also, please take a minute to rate and review us wherever you're listening to this episode. And let John know what he's doing wrong on Twitter using his handle @techguy. And let me know how all the good stuff that I'm doing at Colin_Hung. You like that, John?
Yeah, it seems appropriate,
I seem to be losing the other competitions on Twitter, so I gotta force the issue here.
Hey, I'll take all the constructive feedback I want. That's the best education possible.
There you go. There you go. All right. So we talked about success stories. We talked about potential disasters. John, who or what is on your list of things to watch in 2020?
Yeah, so the things that are making me most excited are actually the provider innovation groups. So I talked to a lot of vendors, and some of them are exciting, and no doubt I met one today talking about analytics to help with drug diversion, and I think that's powerful and exciting. That's really great. But what I've found is that the innovation organizations at hospitals and health systems are some of the most exciting things that are happening, especially when they're tied directly to an operational outcome. I met this amazing innovation leader from, I think it was Houston Methodist, so a Houston hospital. She actually runs their largest flagship hospital, but then she also is in charge of all the innovation. And what had happened is she actually went to her team and said, hey, let's do a meeting of all these digital health nerds, basically people that were just passionate about digital health and all that it could offer. She formerly worked in, I believe, the Clinton or Obama administration doing policy work, so she understands where that is. She runs the hospital, and then she runs their innovation group with a bunch of other operators, and all of those people have kept operational roles. It's like those people are the really exciting ones, because not only can they go and discover what's innovative, but they can
Right.
operationalize it. So they have to eat what they do and be responsible for what they do.
Gotcha. Yeah, that's super interesting. And yeah, there's all these super women that, well, super people that are, really incredible to watch. One of the ones sort of in the vein of what you're talking about, Neil, I would say Neil Goins and the Dice Group over in is one group that's sort of an internal innovation
Jefferson
group that
Health.
I'm kind of excited to watch for in 2020. I like their tie to the things that they're doing internally at the hospital, and they're not all about the latest and greatest technology. They're about really taking a look at the workflow, really taking a look at how they can eliminate steps and take things out of the process. I really, like you, kind of love that approach to innovation, and I think these internal organizations are really going to be fun folks to watch in 2020.
Another one that I'm really excited about is I just did an interview with Imprivata. Pretty fascinating company. I've always thought they were well positioned because they are kind of the only ones that do what they do, and they've really captured that single sign-on approach, and even the two-factor authentication, the digital identity. And it made me pretty excited to think that they're working on the patient identity side of things as well. I heard someone say that before they were retired, they were hoping to finally have a national patient identifier. That's all great and good, and I think it's needed and necessary, and we should do that. But even more important than that is some digital solutions, because a national patient identifier doesn't solve the John Doe problem. It doesn't really create a verified identity if I'm standing in front of you. And so there are ways to create that verified identity. I would just think about the time I was crossing the border from Jordan to Israel, and they said, what was the address of where you lived? And I'm like, how in the world does somewhere across the world on the border, this little border town of Jordan into Israel, knows where I lived and knows where my dad was from? And yet, in healthcare, when I walk into a hospital, they have no idea who I am and aren't using that type of data to really verify my digital identity. So I think Imprivata is well positioned. They'll probably leverage some other people like Equifax and other people like that to be able to verify the identity. But I think that's a real opportunity and a real problem for healthcare.
I've got a couple of companies to watch. I mean, they probably won't be surprising to people who read my columns and stuff. One for me is Point Click Care, the large EHR vendor that plays in the post-acute world. They've made a lot of strategic acquisitions in that world, home care, in the senior care, senior living, care and age in place kind of software. I think they're doing some really exciting things. And on top of that, what gets me most excited about what they're doing is the work they're doing on Harmony, which is the platform that will allow post-acute facilities to communicate better with their acute care partners. So to really make the transition of care a lot safer and smoother for patients, everything from medical reconciliation to sharing of doctor's notes, and allowing healthcare organizations or hospitals to see the cases and the people that are in their post-acute partners. So I think they're definitely one to watch. And plus, I just like their whole ecosystem. I think it's really cool to see all the people involved there. Another company that I'm kind of keeping my eyes on is Information Builders. This is a company that have been sort of been warming up to, but have been seeing a lot of the progress they're making in healthcare. And especially now with the giant data lakes that everyone has got, and trying to make sense of it and kind of visualize it. I think what Information Builders is doing, which is taking sort of a templated approach to help keep people get started, and by helping people with pre-made templates around quality measures, around costs, is a really interesting and great approach, because it allows people to get up and running so quickly, and then quickly get to some of the more deeper analytics and things down the road. And lastly, I'll say one other company I'm interested in keeping my eye on is Tiger Connect. So they've transformed from just being a texting tool now, and they really put a big focus on workflow and digitally enabled workflow. So I'm kind of really interested to watch them and see what happens with them in 2020.
Yeah, I'm more interested in PerfectServe, who's been rolling up the secure text companies. I'm interested to see how they do, especially with the acquisition of Telmetic and some others. That'll be interesting. Although Volt with Hill-Rom is a really interesting competitor in that space, and you know, Vocera obviously is doing a lot of good work. Spoke is also in there, so it's going to be a battle between those companies, I think, for that space. But how
It's
ironic
definitely
would it be if Point Click Care was the one that solves the healthcare interoperability problem, you know, like that
yeah.
they really push it forward, like a post-acute care company, like that's sad, but it's great that they're doing that work.
No, it is. And you know, on top of that, they're also one of these companies that did not grow up big because of dollars, right? They, you know, post-acute was not part of all those meaningful use dollars that flowed into the
Yeah, they
system.
suffered because of it.
Right. Well, and yeah, so either you could look at that as a disadvantage or an advantage. And I think in their case, it turned out to be an advantage. Their market grew up with them as opposed to artificially was inflated by all these dollars floating in. So anyway, it's interesting. It'll be definitely some interesting things to watch in 2020. And I can't think of a better way, John, than end this episode by talking about what are the fun things or interesting things that you and I are both looking forward to on a personal level in 2020, whether it's a fun conference or an event or anything. What are you looking forward to, John, in 2020?
Yeah, I mean, of course, I have to mention the HITMIC conference in 2020. You know, anytime the healthcare marketing community comes together, it's a good time, and I'm excited to bring them back to my hometown in Vegas, which is always a great time. And you know, the interesting thing is we could go to, you know, we could go to North Dakota and we'd have a great time. So, but you add in Vegas and a great community, and you know, that's just incredible. But you know, I mean, there are a lot of things I'm looking forward to in 2020. I think there's a lot of regulation coming down. We talked about the information blocking and things like that. I'm interested to see where that all comes together. But I think I'm more interested in seeing what happens with APIs. I think the EHR vendors are finally getting behind it with a little bit of extra energy. And I think 2020 will open that up in a big way. And we'll start to see innovations that we've been waiting for many years. If it's talking to even a company today, they don't necessarily use the API, you use access to the data to be able to do it. And it was fascinating. After we talked about their product and their solution and how they bring EHR data and ERP data and cabinet data and, you know, and even Kronos like workforce system data together, and then we talked about it and we're like, you know what's interesting? If meaningful use hadn't come along, you wouldn't exist. You wouldn't have this data. You wouldn't be able to do this. So, you know, it's like, yeah, you know, EHRs are still not usable. They're you know, they're part of the burnout problem, and they could be better than they are today. But there's a whole suite of products out there and solutions that are now going to be possible because of APIs into the EHR and access to the EHR data to be able to understand things like drug diversion and things like inappropriate use of data or inappropriate prescribing habits, or, you know, all of these things that are going to be happening in 2020. Those are now possible because we went on the EHR. Yeah, the data is not perfect. Yeah, it's not as usable as we'd like, but man, what potential and what opportunity is there?
Yeah, you know, I like you, how are getting excited about that. I am getting super excited and looking forward to reading more stories and writing more stories about the focus on social determinants of health. To me, that's sort of a very exciting area, and I'm looking forward to hearing more. I don't think obviously we're not going to solve it, but I think we're finally going to make meaningful progress towards understanding it and looking at it and surfacing information so that people can make decisions. You know, again, I go back to the example of why can't a doctor look at the financial health of one of their patients and go, oh, you know what, I can't recommend this treatment because it's not going to fit into where you are right now. So instead, why don't I recommend this? You know, that should be part of the care you receive. And I think in 2020, we're going to start to see some of this kind of creeping in. And I'm looking forward to seeing how social determinants work their way into everyday care, as opposed to sort of being just part of the population health programs, right? Like SDOH needs to be factored into all of care at all levels. And I'm excited to kind of see that in 2020. Some of the more fun things I'm looking forward to, John, of course, I'm looking forward to hymns. It's nothing like, getting together with 48,000 of your friends, right, and colleagues
Our closest
in Orlando, which is where I am today, actually. I'm pre-scouting for hymns, that's what I'm doing. No, but it's always a great time just to see everyone, to see who's creating the buzz, to see what the latest buzz is going to be, and of course just to have the opportunity to take that wonderful team photo, the HCLDR, HITSM, photo that we take every year on the steps, and I think that's a lot of fun, and just people we don't see for years. That's probably one of the few times you get on some for that. HITMIC, Expo, our health event will be fun. And just, I love going to conferences, right? As much as I complain about it, I do love it. And so that's what I'm looking forward to the most.
Well, people is always the best part of anything in life, I think. So that makes sense from the conference perspective. Interestingly, I'm more bear on SDOH. I think it's exciting. I think it's essential, and I think we won't make any progress on it in 2020. So I guess I'm on the other end from you in that regard. I think we need to, but I just think the infrastructure and the payment mechanisms and all that are not there. The doctors aren't ready to do it. We don't have the other people ready to do it. So anyway, I think it's needed, but I think 2020 is good. At the end, we're going to look at it and say, man, we're still where we were in 2019.
And actually, John, that may be something I'm actually looking forward to, and I'm sure our listeners are too, right? I'm looking forward to disagreeing with you more on this show in 2020 so that we can have more back and forth and more meaningful discussion. Because, for the first few, you and I were in violent agreement. And now, lately, we're starting to get a little bit opposite sides, which will make for a much more fun conversation.
I love disagreeing with you, Colin, anytime.
Well, that brings us to the end. So thank you to all of you who have tuned into this episode of Healthcare IT Today. Find out more details about our show by checking out the programs page on healthcarenowradio.com. And share your voice and give us your feedback by using the hashtag HITSM on Twitter or by going to our website, healthcareittoday.com. I'm Colin Hong, along with my friend and co-conspirator, John Lynn. Thanks for listening, and have a great week.